Hello, I'm Dr. Brandt Gibson, and today I want to give you some of the facts. One of the things that people think about is they don't understand how often or how common peripheral neuropathy really is, how often it presents in different situations. So I want to give you a little bit of the facts. Did you know that it's estimated that 30 million Americans suffer from some type of peripheral neuropathy? 60% of those individuals are considered to be diabetic. 10% are chemotherapy induced, 2% are HIV/AIDS, 5% are other, and of that, you've also got 23% that are often called idiopathic. I'm going to come back to that because I want to help you understand that a lot of times the idiopathic is just they haven't gone through the steps to figure out exactly what's going on. So 60% of those with diabetes, really between 60 and 70% of those with diabetes have peripheral neuropathy. What that includes is that nearly 54,000 diabetics have amputations each year, and 75% of those amputations are preventable. So if you understand and treat your diabetic peripheral neuropathy, you can actually prevent this problem. 30 to 40% of cancer patients have chemotherapy-induced peripheral neuropathy. Chemotherapy-induced neuropathies can be caused by the drugs that are used. They can be caused by radiation or some of the other treatments. And the onset and resolution of symptoms can vary depending on how it presents. But if you go in and figure out what's going on, you can actually help this. 33%, 1/3 of all HIV/AIDS patients suffer from peripheral neuropathy. But did you know you can also get peripheral neuropathy from immune system disorders like Guillain-Barré syndrome and chronic inflammatory demyelinating polyneuropathy, Charcot-Marie-Tooth. You can have autoimmune type disorders like celiac disease, lupus, rheumatoid arthritis, shingles. You can have excessive drinking of alcohol causing this. You can have vitamin deficiency or vitamin dependency. Most common, of course, being vitamin B1 and vitamin B12, but we're actually seeing it in vitamin Ds, and we're actually finding that if we add vitamin C and some of those kind of things, we can actually help repair the peripheral nerves. Any systemic disease problems that you have, kidney disease, liver disease, genetic diseases can all have peripheral neuropathy symptoms. You can have multiple toxic substances. Even some of the medications that you're using could be causing your peripheral neuropathy. I have patients that antibiotics have caused it. I have patients that actually even some of the diabetic medications can cause it. Blood pressure medication can cause it. Cholesterol medications can cause it. So the idea for you is that if you have the symptoms of peripheral neuropathy, we should be figuring out that cause, because once you know the cause, you can start treating the cause. If you don't know the cause, you cannot treat it. So you need to figure out the cause, and then what you can do is you can say, okay, what am I going to do to either eliminate, reverse, treat, or repair the cause? So if you can do any of those four, eliminate the cause, reverse the cause, treat the cause, or repair the cause, you can actually manage your peripheral neuropathy. So this is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 305. And really what it's talking about is how common peripheral neuropathy truly is. And truthfully, you need to be treating it. And there are things that can be done. If you'd like additional information, you're saying, okay, I need to know what those treatment options are. We have a weekly webinar every Thursday or Friday where you can actually go and you can learn more about your peripheral neuropathy. Go to the neuropathywebinar.com and learn as much as you possibly can. Thank you. This is Dr. Brandt Gibson. Have a great rest of your night.